Okay, I got a lot of questions for y'all. I'm going any kind of order, so I just want you to take it, the mic, and run. I'm going to give you my mic even since we have a bigger panel. I want to understand your journey to this space. What was the catalyst that made you say, "This is my purpose"?
Well, I was Cecily here. Hello, everyone. So I will say that 2013 was a significant year for me when I was sitting in a conference in Fort Worth and learned about the devastating disparities in Black infant maternal health outcomes. I didn't know, I didn't have any trauma with my birth experiences, but upon hearing about Black women dying at 3 to 4 times the rate of white women and our babies dying at 2 to 3 times that rate, and knowing that 80 to 90% of these deaths are preventable, I knew something needed to be done. And so that's when the seeds were planted in my heart to found Abide. I mean, it wasn't, it took a couple of years, but that was the beginning. Like, why is this happening? This is not right. Black women need to be heard, seen. These are preventable. Something, when we know something is preventable, it means that something can be done about it, right? And so decided to just put my feet to action, and so now here we are. We exist.
And I want to add one of the things that I think drives the work that we do at Viola's House is connected to the social determinants of health, right? And so when we think about social determinants of health, we're looking at the conditions, right? Some people hear this term, they don't fully comprehend what that means. Viola's House is committed to the conditions where people are born, where they live, where they work, where they play, where they worship, right? And so for us to focus on the comprehensive services and all of those areas, we've been doing this work all along. These stats are just numbers that are now surfacing and creating the alarm to say, oh, something's wrong. But when we think about organizations like Viola's House, this work is happening in silos. And so I think the passion and the commitment that all of our staff have at Viola's House is saying, we can't do this in silos anymore. And the first panel talking about the unconventional collaboration, that's what the need is right now. But I think that's the connection, is those social determinants.
But I want to ask a deeper question of you, Casey, because your background is extensive. So why did you even say yes to being in this space? Because you could have picked a lot of other things. So what was the calling for you?
As a Black woman, it's my responsibility to help my sisters, right? And so coming back into the nonprofit space and putting, I guess, the boots on the ground, I don't like that saying, but it fits. Personally, I recognize the purpose and the calling to do this. And when you hear the voice, when you know that there's something you can do, you do it. You do it.
So my perspective is a little bit different. So I was born in Nigeria, and my interest in medicine and women's health stems from that. Like growing up in a community where access to care is non-existent, little to non-existent, and seeing women die from preventable diseases, right? Like childbirth, genital mutilation, and all that stuff. So I was like, surely I wanted to address this issue as a little girl. And I'm like, when I move to the United States, it's going to be better, because the United States is a superpower. And like the issues that we face in Nigeria surely can't be here. And then when I moved to the United States, I realized that barrier to care disparities transcends international borders. And so when I moved to the United States and I realized that we spend so much money, we spend the most on healthcare compared to other high income countries, but our outcomes are abysmal, right? And then when you look at maternal health as a just an example, it's horrible. And then when you break that down even further, by ethnicities, you see that the burden of those statistics is disproportionately affecting us. So when you look at the statistics of maternal mortality over the past decade, you might be tempted to feel like, oh, the United States is doing well. In 2022, it was 22 per 100,000 deaths. In 2023, dropped to 18. But when you break that down to see like, okay, compared to a white woman, where do we stand? Then you realize that in 2023, although the national average of maternal mortality in the United States is 18 per 100,000, when you look at the black woman, it's 50 per 100,000. So for a country that spends so much on healthcare, and then to then look at the statistics. So as a physician who's an OBGYN and cares for women throughout their whole pregnancy, as an African American woman, and as a mother who's gone through pregnancy several times, it bothers me, right? And that's why I'm in this space, that this should not happen in a country like the United States, especially someone like me coming from Nigeria where that was my story. And so I'm glad we're having this conversation today. Like, what are we doing? What can we do, right? Like, what collective action and advocacy and collaboration can we form to sort of address the conditions, right? Because sometimes it's so easy to, it's not easy. Treating the clinical problem is not easy. But as an obstetrician, I'm trained to treat preeclampsia. I'm trained to treat diabetes. But what about the social determinants of health? What about the housing inequality? What about the transportation insecurity? What about the food insecurity? Those are the issues that contribute to the statistics that we're talking about. And that's why I'm in this space.
And mine is more, it's simple. I've known from a young girl that I wanted to educate women. I was raised in a single parent home, and I watched my mom struggle. I watched her struggle with her own health. I watched her feel like she wasn't being listened to. So I said, you know what, I'm going to go into healthcare and I'm going to help women. I'm going to teach women about their bodies, just as simple as hygiene. Like, I just wanted to teach. And so going into nursing and learning a holistic view of how to care for someone, I was like, okay, this is my niche. Like, I'm going to talk to you. I thought I wanted to be a lactation consultant. I started collecting my logs of I'm going to teach women how to breastfeed, you know. But just looking at the stats, looking at the information is like, okay, I have a voice and I'm going to use this voice. I'm going to use all this education, all this money I've spent, you know, to teach others and to speak up for those who couldn't speak up for themselves and who are not aware. And so that's my passion. That is what keeps me going. That's why sometimes I'm known as a disruptor, and it gets me in trouble sometimes. But I call it out, you know. That's what I do, you know. But that's what is needed. We need someone that's going to be bold enough and brave enough to speak out about what's right and what's wrong. And so that's why I do it.
All of y'all are bold and brave to do what you do. So thank you. You know, I remember hearing the story of Serena Williams, and I remember thinking, if that can happen to her, what is happening to other Black women who may not have the wealth and notoriety and celebrity? And so my question is, we hear those stories. Explain to the audience the challenges of maternal mortality and maternal morbidity and your experience with either or both. Why are Black women the highest at risk for both?
Okay. Well, I started off. They've said a lot of it. It's the social determinants of health. People oftentimes confuse equality with equity. We need different things. I'm not going to be worried about my health if I don't know where I'm going to get my next meal from. I'm not going to be worried about going to the doctor if I can't pay for my lights. Okay? So for us, being impoverished and being put in situations where we're impoverished because we don't have the access to the jobs or the access to the health care or the access to the food, we are at a higher risk, you know. So if we're not addressing our hypertension prior to getting pregnant, we're coming in with the problem.
and then we're being ignored. So we have a problem when healthcare providers are not being held accountable for addressing these situations, for addressing, there's a such thing as preconception counseling. Like, encourage your women to go speak to an OB/GYN or your women's health provider and say, let's start planning for this pregnancy. Okay, your blood pressure is high. You are pre-diabetic. What can we do to make sure that you're not at risk during this pregnancy? So things like that, and not addressing and meeting these women where they're at, is why we're at a higher risk, in my opinion.
I'm going to say something a bit bold. Those are all social determinants of health for sure, definitely contribute. But as long as whiteness is centered, Black women will continue to die.
Can you say that one more time, please?
As long as whiteness is centered, Black women will continue to die. It's systemic racism. It is biases in healthcare that are contributing to these deaths. It is not Black women's fault. It is not Black families' fault that our mothers and our babies are dying. Black women deserve quality care that centers cultural humility, that is respectful and honoring of their humanity. And quite frankly, I'm sick and tired of the dehumanization of Black women and Black women not being heard. I really feel it is as simple as that. Black women are not heard. Black women are ignored. And we at Abide, our clinic opened in the midst of the pandemic, and the quality of care that our clients are seeing is excellent. We have not experienced any infant or maternal deaths. You know, our preterm birth rate is half the national average. Our yes, less than half the national average. Our babies are being born at healthy birth weights, you know? And part of that is seeing clients for who they are as human beings worthy of care. Quite frankly, historically in this country, we have continued to dehumanize Black women, and Black women have never had agency over their own bodies. These are women who have chosen to carry their children to birth, you know, to term, and they are not living to raise their babies, you know, or their babies are dying because they're not getting the right care, the quality standard of care that they rightfully deserve. So despite, you know, a lack of access or financial support or all of the social determinants, just if we were to wipe the slate clean and we have mothers who are wealthy, educated, even them, wealthy and educated, are discriminated even more. You know? So there's like an intimidation factor for even women who hold this standard, these women who have worked twice, 3 times as hard to get to this level, you know? And so I'm tired of it. And so I just want to just really make that clear. All of it matters. All of it counts. It all contributes. But part of it is racism. Part of it is biases. So.
And I really appreciate you bringing that to the table, because one of the things that I see when we look at maternal mental health with those racial disparities is, for example, postpartum depression does not look the same in a Black woman as it does in a white woman, right? But we're all using the same screening tool. And so the challenge with that is if a woman is coming to share her symptoms, if she's brave enough and trusting of that provider to even talk about those issues, it doesn't look like hopelessness and depressed mood as it does in a white woman. In a Black woman, it often manifests as self-criticism and fatigue. Now, who understands postpartum depression as that definition? Where is that taught in the education for them to say, okay, there's something going on with this person, and I need to support them. That is the disparity that you're talking about.
I mean, I agree 100% with everything that's been said. But your question is loaded. Let's acknowledge that.
All of them are.
Right? Because there's not a singular factor that can explain why the Black woman's maternal mortality rate is 50 per 100,000, while the national average is 18 per 100,000. It is a combination of factors. And in my practice, I will often hear Black women say, like, wow, this is the first time I've been heard. Or this is the first time I've felt seen. And like, thank you so much. Like, having you in the delivery room just made me feel so much better. Like, not like the kind of care that it would have gotten from my non-Black counterpart would have been subpar, hopefully not. But it was just the presence of you being there and understanding the struggle made a difference. And they're like, wow, this is the first time I've seen a Black doctor, right? And so not only are we facing disparities and social determinants of health, but it's the unconscious bias that we bring to the care, right? And so when I take care of my patients, I'm intentional about the care that I give. I'm intentional to like I hear you. Hi. I'm intentional about the care that I give, and I'm intentional about my interactions with them because there's a lot of hesitation when they're coming to care, right? Like, there are people, or I have patients who would not come to care because they're like, well, I came the first time and they sent me home and didn't even listen to me, right? And then the next thing we know, something bad has happened. But if we take the time to acknowledge that we all have our biases and like acknowledge that, and that when a patient says, this hurts, this hurts. Like, it's not like, well, maybe you're exaggerating. Are you sure it's not this? Are you sure it's not that? It's acknowledging that, like, I hear you, I see you, and like, let's walk through this together. And I can't even tell you how many times like a patient walks into the room and you can tell that they're guarded. And they're guarded because of their experiences. They're guarded because they're tired of being battered and like not listened to. And then by the end of the visit, they're like smiling. I'm like, oh, thank you, God. Right? And if we can all just like acknowledge that as we move through the care, as we care for patients, and know like, hey, this patient is far more than just their clinical condition. They're a human being with experiences, and like how you interact with them matters. And that's part of the mortality that we're talking about.
You know, the sad thing is that this continues throughout a Black woman's life cycle. Because I'm watching my mother in her late 70s say she doesn't feel heard, and that doctors, minimize what she's saying. So it is a problem in the system, to your point, of Black women not being seen and heard and valued, and our experiences are minimized. And so thank you for calling that out. I want to ask you this question. We know that this day is important, but why do we need this conversation? Why is this conversation so important and timely? And how can nonprofits advocate in this space? But how can individuals advocate for themselves and each other in this space? What does that look like?
So for me personally, and please correct me if I'm wrong, but I can't think of any other ethnic group where the woman figure, the mom, is so central. Like in the Black community, the Black woman is the centerpiece of her household, of her community. And so just thinking that a singular decision to become pregnant can be a death sentence is loaded. Like, it means something. Obviously, I'm not saying it doesn't mean anything in any other context, but it means something. Because when you get pregnant, or you choose to become pregnant, or you become pregnant, it's often is clothed around this joy and happy situation. But to know that that can very quickly become a mourning situation can change the trajectory of a family, the fabric of a community, right? Like the entire fabric of her home. And that's why this is important, to say, hey, like our Black moms and our Black women are important to our household and to the fabric of our community. And so the death rate, the maternal mortality rate that affects Black women is unacceptable. That's one reason. And like how can we as individuals like advocate for ourselves? Please feel empowered, right? Like I tell, like, not, it's not often that patients come and I'm like, okay, so what happened in the last visit? They're like, I don't know. I'm like, so then what did they say? They're like, I don't know. I'm like, did you ask any question? They're like, well, they just sort of breathed in and breathed out, and so I didn't really know. And I'm like, the next time I come in here, or any other member of my team comes in here, you hold us accountable. You do not leave here until you understand, right? Because like you come, you take time from work, from taking care of your children, from your life activity, and you come see me, not because I'm particularly beautiful. I am beautiful. I mean, not because I'm so personable, but like you're coming here for a reason, and I didn't even meet the bare minimum criteria that when you leave here, you know what's going on. So I encourage each and every one of us to spread the word and be like, your doctor is here to serve you. I mean, I never wear white coats. Nothing against white coats, by the way. I never wear white coats because like I don't want it to be this power dynamic. I need you to understand that we're like in a partnership, and like before you walk out the door, like you better know why you came here and what happened so that you can tell me the next time. And then in terms of like community advocating, no one organization can cover all the bases, right? Because the issue at hand is so important and so large and so enormous. And that is why it is important to partner with organizations. And that is why we partner with Viola's House. And that is why we partner with Hope Cottage, right? To make sure that like the parenting classes that we need for our patients, they have access to it, right? And that we partner with other organizations that the social determinants of health piece that we need to get our patients connected to, that they have those services. And so it's not just an individual race, it's a community effort. And so acknowledging that and reaching out to all your community partners to make sure that your organization becomes a one-stop shop for your patients, another way to also lessen the burden. And at HHM Health, we're doing that. Like, that's what we do. Make sure that when patients come, that before they leave, they have access to like all the wraparound service to ensure that their maternal journey is successful.
To answer your question, why is this Black Maternal Health Week important? Because Black women matter, because we matter, because we're dying unnecessarily, because it's preventable, and because when we care for Black women, we care for all women. When we care for Black women, we care for all women. The rates improve, period. As far as nonprofits, I really want to speak to those who may feel this is so big, I don't know what I can do. So I'm the only one up here that doesn't have any letters behind my name, okay? No college degree. I'm not a doctor. You know, I was a very green doula and childbirth educator. And I saw that something was happening to my sisters, and the Lord pressed upon my heart to do something. And so I really want to encourage the underdogs, you know, those who feel like they maybe don't matter, that if a seed's been planted in your heart, you can actually move on that. And I encourage you to move without fear and just like trust yourself. And trust me, it took me a long time to actually trust myself and trust my gut. And I think that's something that a lot of Black women deal with, because we're constantly questioned. We're constantly gaslighting ourselves. And, you know, because we live in a system that doesn't, you know, honor our humanity and our thought process. And so for any of you that are here and listening to this, I really just want you to see that this is a real issue that can be fixed. And the solution is action. It's action, it's collaboration, it's partnership, it's trust, it's belief, it's stakeholders saying, I trust you to know your community, okay? I trust you to support, you know, those that you're supporting. You know, it can happen. And so, no letters behind my name, and we did it. We did that. We're doing that.
So they say the measure of a nation is based off of the health of the women. We're failing. The United States has a big old fat F because, like you said, we're not healthy until Black women are healthy. So that's why we're talking about it. I was in a space where we were talking about Black Maternal Health Week and how we were going to celebrate it. And um, someone said, "Do we have to put Black behind in front of it?" Yes, we do, because it's Black women that are dying. We don't need this translated in Vietnamese. We don't need this translated in all these languages. This is for Black women. We need to educate everyone about the death rates of Black women surrounding childbirth. And so it's important to have these uncomfortable conversations and to let everybody know what's going on. So that's why we're celebrating it. And that's why we're educating. And that's why we're having our baby showers and all of the different programs that we're having to bring this to light. When it comes to nonprofits, y'all keep doing the work that y'all are doing. At Parkland last year, we delivered well over 13,000 babies. We don't have enough providers in the clinics. We have 11 women's health centers, all ran by nurse practitioners. We can't see all those patients, including the family planning and gen patients that need help. So we need these nonprofits. We need y'all as resources. We need to be able to say, hey, have you checked out such and such and such? Have you heard of a doula? Parkland has made a lot of strides. We have a new committee called Respectful Maternity Committee. And we are educating nurses, L&D nurses. We're trying to get some of our physicians in there so they can see what they can do to make sure that our women are getting respectful maternity care. With that being said, we've also introduced allowing more doulas and actually promoting more doulas to come in because our patients don't know. They don't know what to ask. They don't know what's going on. We talking to them and they're just, like you said, they're just like deer in headlights. They're just, I don't know what's said. So let's get somebody in here that's gonna help you understand that. Even if so, yes, we holding each other accountable. I tell my providers, I want people to come here because they want to come here, not because they have to come here. And that entails that you make sure that they feel heard, they feel listened to, they were taken care of. It could be something that's simple to you, but it's not to them. It's important to them. And I'm going to hold your feet to the fire. That is my job as your leader, to make sure that you are providing the care that these patients need. I practice Southern Dallas. We have one of the highest rates of African American moms come to my clinics. I'm not gonna sit there and be quiet. If I see anybody feeling like they weren't heard, we're gonna address it. And so I think that's what we have to be better about, and making sure we're holding our providers accountable.
And I think the consensus, what we're hearing is the reason we're talking about it, it's a crisis, right? Yes. Everything that all of you have shared and what we've been talking about today speaks to the tragedy, right? When we think about the families, the lives that are impacted, not just our communities, not just the ones that lost their lives, this is a ripple effect that will impact generations. This is serious, right? And I think the magnitude of the issue, that's why we're talking about it. And what nonprofits can do is get out of their comfort zone. Nonprofits have to have conversations with people they don't normally talk to in order for us to impact change. And we have to do it, and we have to do it now.
Last question. Nuggets of knowledge. What do you want the audience to know? That they can walk away with some tangible information and action steps of what they can do and what they need to know. If it's data, what is it that hasn't been said that they need to know?
I would say know the resources in your community. Look up community advisory boards for these major organizations and join them so you have a voice. Know what nonprofits are in the area so that way you can help a loved one. If you can go with them to their appointments, go with them. You know, as those who have ever been pregnant, I have 2 kids of my own. it's a whirlwind of information coming to you. You got a lot of emotions going on. I don't remember everything that was said to me, so maybe coming with them, be their advocate, take notes for them. And then y'all can have those conversations. Okay, next visit we're gonna ask this question, or we're gonna send a message and ask this question. So just try to be involved as much as possible, whether that is on the side of joining the advisory board or knowing what resources are in the community or going to those appointments. When I say resources, I'm also a member of the Links Incorporated, and we just did a Black Family Wellness Expo 3 weeks ago at Concord. We had so many resources of doulas, of nonprofits, Parkland, we were out there. These are resources that a lot of people didn't know about. And we had a great turnout, but it could have been so many more that showed up. We also have our baby shower coming up at Parkland on Saturday for Black Maternal Health Week. So get to know, join these social medias and everything so we can find out what's going on and you can share that information.
Okay. Well, Abide Women's Health Services is located in South Dallas off of MLK, where we provide prenatal and postnatal care and support, along with childbirth education, doula support. We have excellent partnerships and referral processes with Delighted to Doula, working on it with Hope Cottage, Viola's House. And so something that I wanted to share is that there are so many people and entities all across the country that are advocating for Black women to receive accessible health care, not only in the prenatal stage, but also birth, to be able to birth on their own terms where they want to birth. And so there's Birth Center Equity that's led by BIPOC folk. The goal is to expand the number of birth centers all across the country, and really centering Black, Indigenous, and people of color, and honoring culture, just the cultural practices and accessibility to that standard of care. And there's the National Perinatal Task Force, which it's national. There are so many individuals across the country, so check that out. And I can't help but to mention Amari Maynard, who lost his partner, Shamani, and I apologize, Amari, if I mispronounced her name. But her story is the story based off the documentary Aftershock. And so he created and this is his partner, he created a men's group to support men who have lost their partners from childbirth-related causes, called the Luxor Collective. And so, if you know anyone, this is an excellent group for them to get partnered up with so that they can find the support they need during this crucial time of healing. And I guess the last thing that I just want to say is to step out on faith and let go of fear. Black women deserve better, and we can really be part of the change. We can change this. A collective effort, we can change this. I keep hearing the word ecosystem. We have a really disgusting, messed up ecosystem that we're living in right now. And so part of what we can do collectively is create a new, healthy, thriving ecosystem that is sustainable and flourishing for all people.
I just want to, first of all, thank you so much for the opportunity to be here. And I just believe the parting words that I have is I currently work at HHM Health. It's a patient-focused community health center. So there are not a lot of community health centers in the Dallas area. And we're kind of like a full spectrum health center because maternal health starts before your pregnancy. We're talking about preconception counseling earlier. So we're able to provide both OBGYN, or both obstetrics and gynecology care that precedes even your pregnancy, and then after your pregnancy as well to continue your care. And we have a lot of partnerships. We talked about partnerships today with Viola's House, with Hope Cottage, to make sure that we're able to give you all the services that you need. And finally, I want to empower each and every one of us to be our own advocates. It is important, it is necessary, it is life and death. It is that important that when you step into that clinic facility, that you channel in that strong Black woman that you are, and that you take charge of your care. And like when we use those jargons that you don't understand, you're like, 1 second, say what? And like hold us accountable until we break it down in a language that you understand. And like when you go into labor and delivery, understand that this is your body and this is your child. And like you own and run that. And I want you to feel empowered. And if you ever get to a point where you feel like they're not listening to me, ask for a change of provider, ask for another person. Like before you run through the whole clinic, you find someone to listen to you. Truly will. And so I just want to encourage each and every one of us to know that your clinicians, your providers are here to serve you. Like we're not here and you're here, we're partners, right? Like this is like a partnership.
I think one of the things for all of us to think about is there's a fire that's stirring up in each and every one of you right now from something that you heard today. And so my hope is that everyone takes that and you fuel it. And what that looks like is connect with, whether it's your nonprofit, your practice, your family, your circle. Start having these conversations with the people around you. Teach them about Black maternal health. Education is going to be an important aspect to this because without understanding it, we can't do anything about it, which is why we're here right now talking about it. But don't allow, as someone said, fear to squelch that fire that I literally, when I look at the audience right now, I see it. You all are captivated, you're concerned, you're angry, you're frustrated, you're grateful to be in the space. There's all of these different emotions that are happening, but don't leave this room and then just go about your evening. Take some time for self-reflection and ask yourself, what are the areas that I am strong in that I now can make an impact? And I think that's going to be an important piece.
We got baddies up here on this panel. If I were to read all their resumes, I'd be going, they are amazing. So my first question is, share your definition of philanthropy, because we hear that word a lot, but what is philanthropy and what do you believe is its role in advocacy and addressing these kinds of issues?
Ooh, that's a full one. So philanthropy is really identifying the need in the community first. Really identifying that need for us here at United Way Metropolitan Dallas, identifying the need, reaching out and looking at the partners in the community, because you all, because we'll have a providers panel, you are the ones who really see what's going on. Boots on the ground, here's what families need. And then that's, for us, that's where philanthropy comes in. We work with our corporate partners, we work with all of the state and federal grants, if we can, to really identify those needs and then reach out to our partners that we're aware of, and or go to various coalitions to learn of new partners to bring them into this landscape to say, hey, we see that there's a need. Is your organization able to help us change the trajectory of this need? And so from the funding landscape side of things, it has been very interesting. Is the best word I can say right now, from private, federal, state, and corporate. And so one of the, I think, exciting things about United Way is that we have a variety of funding sources that we ourselves, yes, can be seen as a funder, but we're also a provider as well. And so being in a very very unique space, we're able to listen and partner with our other funders to say, hey, we have this grant. What partners are you working with that you know have a need and they need supports? And so really working closely in the funder space, that we're saying, hey, let's work together to make sure no organizations fall within the gaps. And if we see organizations fall in the gaps, what can we do to bring them up? How can we support them? So it's kind of twofold for us.
And it's interesting, before Dimple starts, I think folks don't understand that United Way is both a funder, a provider, and that you fundraise. So it makes you a very unique model, because as you are trying to help community, you are also trying to raise money to be able to continue the work that you do.
Yes. Yes, and braided funding is a necessity for us at United Way, teaching our local partners as well. Braided funding. I will say my timesheet, I have 6 different funding streams supporting my salary because you have to be strategic as you are applying for grants, is to weave and braid the funding streams. We are talking about maternal health. Maternal health includes early childhood. Early childhood education, early childhood health, but it's also income as well. Because how are we going to be able to provide for services? We want a doula, we want a midwife, we want to have a birth in a hospital. It's all encompassing when we talk about United Way. Education, income, and health are all intertwined in this work. And so that's how you break those funding streams.
That's a lot. And then what makes CFT unique is that you all also are a funder. You have donor advised funds that you all manage, and so very different model than like a traditional foundation.
That's right. When I think of philanthropy, I think of it broadly as just non-public funds that are being used for community good. And we're fortunate at CFT that our funding does come from community members who hold funds with us. Some are living donors, so are donor advised fund holders, but we also have deceased donors who have left their estates to us for us to steward those dollars into the community. We're privileged enough to be able to do that, but we are so dependent on the community and the data to help us identify where we can make the greatest impact. And I say both because I really do think both are important. Community voice is so important in understanding what is happening, how it's happening, who's impacted, but I also think a broader picture of what the data is showing is so important to weave into that story to help us understand how we can make long-term sustainable change. Because I think there is the individual stories, just like today, and my heart goes out to both of your families, that are so important to understand as individuals. And then we also need to understand the ecosystem and where we have opportunities to change so those stories don't repeat themselves going into the future.
So one of the things that you said, Naila, that is very important to not overlook is the current funding environment that we're in. A number of funders have said to me they're getting 3 times the applications that they've received because of what's happening federally. How does that impact both of y'all's work, and how does it help you to make decisions about even supporting this kind of work?
Yeah, I think, I will say, I think we're in a very unusual time. This is unprecedented. We have gone through periods where we've seen high need. I think COVID was a great example where we saw high need across all sectors. Right now, I think what's the scariest part of what's going on right now is just that we don't know what the future is. It's a period of hearing of changes, but not understanding the impact of those changes, of knowing folks are impacted, but not really knowing who directly is going to be impacted long term. And so for us, it is really a day by day, following the news, understanding what programs are being impacted, trying to identify who within our community is being impacted by what has just been reported out, and then continuing to follow along to understand, is this sustained? Are there changes? Are there other things that are coming in to help, reverse those changes? I think we're in just a very dynamic period. I wish I could come here and say, I see the future and this is the solution and we know exactly what to do. I think it's going to require all of us, nonprofit, community members, philanthropy, to be nimble, to be open to change and flexibility, to be able to be responsive. But I think also it's going to challenge us regarding the status quo. Are we doing the best that we can? Is the system we have in place the best system? Do we need to think about collaborations differently? Do we need to think about the way that we are coming together to address problems differently? And I think you had mentioned advocacy, just in thinking of, are there different avenues that we need to take to create sustainable change? I think philanthropy can't fill in the gap of federal funding. There just aren't enough dollars. Those federal dollars are millions and billions of dollars, and we really have to think in new ways, and I think it's not too early to start thinking about that. So, and I say that as we as a collective. It really is not the funder community that is in charge of this, nor is it just the community members. I mean, if we really want to make change, and make an impact in our community and solve problems, we are going to have to work together.
I wish I can just say ditto, because Dimple, that was amazing. But yes, especially being at United Way, I think we're pretty much known in the community as providing grants. And so recently we just had our community impact grants process close. And this was the first year that we received triple the amount of applications. And so it was new organizations, obviously looking for funding. It was seasoned organizations that we've seen, and it was difficult. And it's hard being on this side of things and knowing the great work that is being done out there. But to me, it's like, that's okay, because I know those partners and I know they do great work. So unfortunately, the organizations who potentially, for that CIG process that did not get funding, okay, there are other avenues that we can partner, being able to support. I think this is a prime example. When I reached out to Thana and was like, hey, can we use your space? Yes. It's about Black maternal health. Oh, well, in one of my budgets, we're able to support events. Is there any way, we would love to be able to support, because I think that's where the support of that braided funding really comes in. And as Dimple said, really looking to our community partners, see how can we collaborate? How can we maximize the dollars that we currently have and impact X amount of communities? And then for our side is, from a fundraising side, how can we work with our corporate partners to meet their social good? What does that look like? How can we amplify that? How can we bring our current partners in the room, into the mix, into the conversation? Because I see many of partners that I've spoken to, I always want to hear the need. I always want to hear the need, because we will have corporate partners, excuse me, state-funded dollars, just anyone really reaching out to say, hey, we would love to do a diaper drive. Well, guess what? I know 2 organizations who always need diapers. And that is an opportunity where, hey, it may not be direct funding, but there are ways to support. And like Dimple said, really working together to see how we can really make that change. What does that look like? Once again, that status quo, we've always done things this way. But hey, with the landscape, how can we kind of mix it up to say, hey, we are here as one. One too many moms, one too many babies are dying right now. This is unacceptable. What are we as a community going to be able to do to support that and move forward?
So why is this conversation important for your organizations? Why would a CFT be interested in Black maternal health in this week? Why would United Way be interested in this conversation? Why is it important to you all?
I'll start this one.
Okay. Go Naila, go Naila, go.
Well, I will say, overall at United Way, we've been in the perinatal space, but it's more so in the home visiting, early education, kindergarten readiness space. And we had the opportunity to partner with other United Ways in the country. One, shout out United Way Atlanta. Great, they do great, amazing work out there. And we really focused on that Black maternal health. How can we reduce mortality? How can we increase partnerships? And that was the first opportunity that it was like, hey, let's call out and piece out our maternal health work. And let's call it what it is, Black maternal health. This is the race, this is the ethnicity that is dying at higher numbers. Why is that? And as a Black woman who gave birth twice in Dallas County, and I've seen my friends go through complications because nurses, doctors did not listen to them, this is not only a personal issue, it's a professional issue as well. So I have the opportunity to bring both hats into it. Because I am a Black woman, I could have been, unfortunately, a part of that statistic. Easily have been a part of it. A Black woman with a master's degree has the same birthing outcomes as a white woman with a high school diploma. And so when we think about that, we really have to say that's not right. It's unacceptable. So what are we going to do about it? And it was just really an opportunity thankfully at United Way, they're like, this is an issue. We need to do something about it. Nyla, would you like to lead it? Yeah. As a Black woman in this space. And so even last week, Dimple mentioned our CFT maternal health cohort group. Last week on April 1st was the third year the Dallas County Commissioner's Court acknowledges Black maternal health. And it's just calling it out. Hey, county, we have to start local. Yes, the funding, federal, state, all the things, but what can we do within our community? And so, we have our 3 pillars at United Way: education, income, and health. This will also increase access. How are we increasing access? How can I work with more partners in the room to meet an abide, to an afterbirth, we got to get to Prinzilla, we got to get to Viola's house, we got to get to Hope Cottage. How can we get everyone working together in this space? What does that look like? How can we increase access? And that's our biggest piece at United Way, is really increasing that access, because you don't know what you don't know. And so if we're able to provide that to the community members, to partners, we can really make that change, because it starts with us in this room right now. We can't wait on anybody else to fix it. Advocacy is great, but we are all aware of the landscape right now. So what, as we in this room, out people who potentially are watching this elsewhere, but how can we do a better job of working together to make sure the families and the communities that we serve here on this soil, make sure that we have positive birthing outcomes and they have all the support possible.
But why is CFT? Why?
Yeah. CFT funds across 4 main pillars: health, wealth, living, and learning. And in health, we funded actually across many different topics, different types of projects, from research all the way to clinical care to public health. And to be honest, it was the data that really was so striking. If we are really looking at our community and wanting to make change, this was something that we couldn't ignore. To see nationwide, Black women are 2 to 4% more likely to die in childbirth. I think our most recent data was 2.5% here in Texas, which is a couple years old. I think that really struck a chord with us. And I will say, it's not just about the birthing experience. I mean, this is all the way from preconception to, between pregnancies, or even being done with pregnancies. I think we really have to look at that as a whole continuum of health and care and needs. I've had the privilege to also be in the delivery room as a pediatrician. In my training, I was delivering babies, so I know also the hospital side. And I also know some of the limitations of training, right? I can remember, my husband and I both are physicians. I remember giving lactation advice to women postpartum when I had no idea. Once I had my first child, it hit me how little I knew, even though I had textbook, definitions and verbiage and things to share and diagrams that I looked at. But I think that just demonstrates how much you don't know that you don't know. And I think, there's gross negligence, and then there is unconscious negligence that happens. And I think we really need to think about this whole ecosystem of how we provide health care to women and what we're doing consciously and unconsciously to really change their trajectory. It really was an honor to be a part of this effort for CFT to want to engage in this type of grant making. I think really pulling together our community is rich with people who are passionate about this space. And thinking, one of the great things, so we have 12 grantees in our cohort, and they're working in all different spaces, from preconception to advocacy work, to doula care, to clinical care, midwives. I mean, it is such a great continuum of people having different lanes, but all aligned in a common mission.
You both have said this word over and over: collaboration. What advice would you give to nonprofits in the audience? I know collaboration is a big one, but talk about, what does that look like to collaborate with a funder? What does collaboration look like for you all to see that in community? Because I remember when I was a funder, I would get so mad when people would send applications to us and go, we're the only ones doing this in South Dallas. And I would be like, hell you are. There are 10 other people that are doing this same work. I can name them for you. And so it would always frustrate me at the fair when people would send those in. And I'm like, you've got to be kidding. And I would see they weren't partnering with anyone else. So what advice would you give and nuggets of knowledge that you would give to folks who want to get funding, who want to do this work better to make impact?
So I will start with when you know one funder, you know one funder. So it's really important to understand the funder you're working with. I think we all have different priorities, we all have different needs, and that's both a blessing and sometimes a curse. The funder community does talk to each other. And so oftentimes, if it's not something that's our priority area, we might be able to direct you to someone who does have that as their priority area, as a strong fit. But when I think of collaboration, I think it is very important to not just think of who are we transactionally partnering with, but who are we walking alongside with to really change the system. So not just do our everyday work, and this is a huge task on nonprofits. So I admit that this is a burden, but not just to do your day-to-day work, but to really be thinking about the big picture. And sometimes that means thinking about how do I work myself out of a job. Sometimes that also means just thinking about how do I make this easier on myself, on the community that we work with, for everyone.
Collaboration is key. Period. Mic drop. But collaboration for me personally, because I have two hats in this space as well. I love meeting people. I love listening and I love learning. When I meet someone, I'm like, ding, and a light bell goes off. And I'm like, you're doing great work. I know someone who does something very similar to you and could share so many nuggets. And bam, there goes a collaboration. Just simply gathering like-minded people together for a common good and change. And what I love most, because all my people I'm like looking at, because some people have known me since the very beginning, and some people I'm like just meeting and just partnering with, but really looking across the room about all the potential collaborations that I'm like, hey, y'all are doing amazing work, amazing work. Did you know about this organization that could really help meet a need? Like, man, I do not have time to do X. Like, that is one thing that's bottom of my totem pole right now, and I could really use the support. Oh, I know other agency that could be a great benefit to support you in that way. And yes, you said transactional, but sometimes the day-to-day is challenging. So if you have an organization or you know of programmings that could be able to support to help meet that, hey, that could be 10 extra minutes that I could get to support to do X, that's great. And I will say in the funding community, we definitely talk because we have to. Because if we have a common goal, we do not want anyone to fall through the cracks. What does partnership and collaboration look like? It looks differently and it changes day by day. It could be just an easy introduction. It could be a financial support. It could be, hey, come to this meeting because I need everyone to hear from you. It definitely just looks different. And always we're here to support. We're here to listen. We just met last week, actually just to figure out what is next in this space. How can we do a better job as funders is making sure we're talking with one another, identifying that need to say, hey, I may have funding for here. Do you have any idea how we can keep a group together as we move forward to really make that change?
I want to open it up to the audience to ask any questions that you might have. Do not ask, can you give me some money? That's not the question we're going to ask, so let that go. Think of another way to do it. Thana.
I actually do have a question. When you said you received 3 times the number of applicants this time for the Community Impact Grant, I think we all are curious as to how do you even get down to the organizations that you will fund? We feel like we go into this pot and there's so many applicants and we never get the answers as to why we were not chosen for the grant when we clearly fit the criteria and have submitted everything requested. I think everybody here kind of wants to know What is that process when you receive so many applicants?
Yes. And so, as you know, we have education, income, and health. And so, each of our colleagues, and we call ourselves community impact, you have a focus area. So, I'm under the education kind of health side of things, overseeing kind of maternal health. And so, when applicants apply, you can choose education, income, and health, your focus area, or it can be a collaboration. They kind of review the applications to see, are you more education, are you more income, are you more health? What's the programming you're applying for? So from there, it's kind of separated between employees with their focus area. From there, we have our community impact grant volunteers that are trained prior to reading applications. And so we try to divvy up the application so everyone has the same allocated amount, so it is fair. And so from there, we have our grant volunteers also read and rate applications. And so through that volunteer process, you are learning, okay, this is the question, this is what we are looking for. Here's our examples. Did they provide zip code? Are they in our priority zip codes? But because we do have our 2030 goals that we are trying to reach, how can this agency really help us move this needle to reach this goal? I will say this year was the hardest year for community impact grants because there were some great applications. And unfortunately, sometimes it's so hard to say, but there is a cutoff. We unfortunately have to say no to some things. And so from that process, after everyone grades the applications, then the lead and the volunteers come together to discuss why you rated that application, or that grade. So from there, you have to do your top X. How many agencies are we able to fund? Because we also have to raise these funds for the next 3 years and guarantee that funding, because sustainability is huge for us. We do not want to just provide you, oh, here's your funding, you're fine. It's okay. No, sustainability is huge. And so we on our side also have to make sure that we're able to sustain all the agencies that we plan to fund for 3 years. And as we talked about the funding landscape, we also have to fundraise to ensure that those community impact grants can stay whole, because that is our goal. And then from there, after the process is graded, then information is sent out to say, did you move forward to a site visit or did you not? And at that time, you can reach out to your lead. That's something you can reach out to United Way. I'm happy to help you identify who that lead is to see if they're able to provide a little bit more context. Right now, it is a little bit challenging because we are in the middle of those site visits. So not everyone who is receiving a site visit will get funded. So that's just, it's a stepping stone process. And then from there, we have to have that conversation, yay or nay. And then that's kind of how it moves forward. It's sad because that's 3 years of guaranteed funding that agencies hope and seek for. And so it's tough when you get that no. But for me in this maternal health space, that's just only the beginning, because there are ways in this space that we can partner. It may not be through that 3-year, guaranteed X amount of funding for a program, but we can be able to support an event. How can we, if there's another grant that comes up, hey, would you be able to do this program for us for X amount of dollars to help meet this need? So it could look different. There are other ways to partner outside of our CIG process. Some agencies in here can attest to that, specifically with me in the maternal health side. But we listen, and we are here to support.
So our process looks very similar, actually. Much of it is the same. We do try and have office hours before a grants process happens to have an opportunity to talk with our team members for our open grants processes, just because of that. We want to make sure that there's strong alignment, that you're going to fit, and that you're not completing an application where you are not the best fit based on what our criteria are. The review process is actually very, very similar. Sometimes we have external readers, sometimes they're all within our team. and we go through a calibration process similar where we were talking about each of the grants. Some of our grants processes are cohort-based, so it's a little bit like, I want to say, college admissions, where you're looking to build the class that would fit together, not just an individual. So it's not necessarily just exactly what you're doing, but how you fit across that spectrum that we're trying to get a voice and thought together. But for the most part, our processes mirror each other. At the end, we also really encourage folks who get declined to come out and take a 15-minute call with us to talk about where, if there are clear gaps. Oftentimes, it is just budget funding. We have a budget that we work with, and that determines how many dollars can be allocated to these various grant processes. And because of that, it is very hard to say no. Even there are many great programs out there and not enough dollars. But again, that doesn't mean that we don't want to engage with you. So I think there's many other opportunities. Some are capacity building opportunities. Sometimes we can help find connections and collaborators that can help you in your work. I think the other place that I have proactively reached out to organizations where I thought there was something in their application that would really benefit them to know. So I think we all work a little bit differently, but we really, our end goal is to help nonprofits, if they didn't get funding in this stage, to at least in the next stage have a higher chance.
And one of the things that I would also say, sometimes funders do reviewer notes. Sometimes it's important to ask, can you give me feedback and give me notes on what went wrong? And quite often, I remember my experience, we just didn't have enough money. So it was just dividing the pie up and hoping that you weren't just putting a Band-Aid by giving a little bit here and there. But I do think it's important to ask for reviewer notes so that you're able to see what they may have said and ask. Set up an appointment and go, what did you see? And sometimes, like I said, it's nothing wrong. It's 700 applications, and I only got enough money to really make impact on 10. So just FYI. I want to give our panel a round of applause. Thank you, Naela, Dimple, thank you.